Ziprasidone, commonly known as Geodon, it is an antipsychotic. The way it works, it binds with dopamine, serotonin, and alpha 1 receptors in the brain, and all that happens to stabilize the patient's mood and hopefully reduce mania and like manic episodes that might be occurring. It is pregnancy class C, and we want to use caution with that with anybody who might be pregnant because it can cause extrapyramidal symptoms in the fetus. So we want to try to avoid that with anybody who might be pregnant. So what are we going to use it for? It is for agitation or violence, excited delirium associated with schizophrenia, and then those acute manic episodes that might be present and causing an issue for us that we have to take care of. Contraindications would be heart failure or acute myocardial infarction, and something to watch for as well is prolonged QT interval, and that's going to be hard to obtain because if someone's having a manic episode, then it's hard to do a 12 lead to find that out, but just something to keep in mind. Adverse reactions that we need to watch for: dizziness, dry mouth, bradycardia, extending that QT interval longer, and then there's a chance of suicidal thoughts with that. Drug interactions to be mindful of: other antidysrhythmics, droperidol, and quinolones. Droperidol is another antipsychotic, and then quinolones are a class of antibiotics. Typical adult dosing is going to be 10 to 20 milligrams, given at IM, and then for the kids, it's not really recommended. Usually we can control them pretty well with other ways. Once you give it, it does start working relatively quickly. It takes a couple minutes for IM stuff to soak in, but it does start working pretty quickly. Peak effects within 60 minutes, and then it can last in the body up to about 3 days. Just depends on what you look at, and each patient's unique, of course. So up to 3 days that it could last. And there's no other real special considerations with this one.